Hi, and welcome to Open Door Veterinary Collective's Lunch and Learn series. Quick drop-ins where we explore practical solutions that organizations are using to address barriers to accessing pet care and resources in their communities. I'm Amy St. Arnaud with Open Door Veterinary Collective, and I'm excited to introduce Dr. Janet Hoy-Gerlach, who's our Director of Veterinary Social Work at Open Door. And we have a great presentation today with so many speakers. We're going to try and fit everybody in, so she's going to help us get started. Take it away, Janet.
Thank you, Amy. And hello, everybody. I am so happy to be here today to share with you about the newly released 2025 Social Work and Animal Welfare Guidelines. These guidelines were developed by social workers from across the United States and Canada who work in animal welfare. And the 5 folks here and another 20 worked together for over a year doing participatory action research to develop these guidelines. And that's thanks to the ASPCA and thanks to Maddie. With us here today, 5 of the guidelines co-authors. These are also the folks who served as the leaders of the small work groups that convene monthly or regularly throughout the whole process and facilitated for the development of the guidelines creation. So lots I could say about each of them, but we'll go ahead and stick with name and title and LinkedIn profiles. You can see on the Maddie's discussion forum. So we have Kayla Anderson, who is a veterinary social worker from the Program for Pet Health Equity at the University of Tennessee. We have Kelly Bremken, who is a veterinary social worker at Oregon Humane Society. Laurie Maxwell, who is currently the director of veterinary social work for MedVet. Augusta O'Reilly, who is the president of the International Association for Veterinary Social Work, and Alexis Telfair-Garcia, who is the director of social work program development for Austin Pets Alive. So jump right in with what is the difference, to get us started, between a social worker and a veterinary social worker?
So you can get a lot of nitty gritty, but at the heart of it, a VSW for short, because there's a lot of words floating around here today. At the heart of it, a VSW and a social worker are the same. They are a social worker. So the foundation is going to be the same. A VSW is not a protected title at this moment. It is a certificate, so it's an additional training. It's not a certification. And so a social worker is a protected title. You have to go through schooling, licensure, but we do the same work. Just as a VSW, we focus on the human-animal bond. So sometimes social workers may look at just the human in a general system of husband, wife, partner, whatever. We actually include a pet owner or a pet caretaker in that as well. So if we're looking at grief, we're looking at how it relates to a pet loss. If we're looking at caregiver burnout, we're looking at how that relates to caring for an aging pet. So just the fine details, but we focus on that human-animal bonded relationship.
Thank you, Augusta. That lays it out beautifully. So we've got social workers and animal welfare settings. What are the guidelines that have been developed and why do we need them, or how are they useful?
So in social work, we have the NASW, so that's another acronym for you. That's the National Association of Social Workers, which is the largest organization for social workers in America. And now what they do is advocate for social policies. They provide continuing education opportunities for social workers. And then they also set professional standards for social workers in their workplace. And now that last point is where the practice standards and guidelines come in, because the NASW hosts best practice guidelines for a variety of fields within social work. such as supporting clients with substance abuse disorders and social work practice and child welfare. But what we didn't have were guidelines for social workers in animal welfare. Now, although it's a niche field, programming for veterinary social work started in 2002, and there are now hundreds of social workers all over just doing work very similar to veterinary social work, but they aren't actually calling themselves veterinary social workers, or they may be completely unaware of the program's existence. Beginning this project, we found that many social workers had this experience of essentially having to build their own job descriptions and assign duties, either from using other social work placements as a template or creating it from scratch, which although that can be pretty empowering, they would also run into the issues of their employers not quite understanding what the role of a social worker is within an animal welfare practice. So what would happen is that employers would sometimes over time end up extending duties past the social worker's scope of practice and then assigning them tasks and roles that were outside their actual expertise. So these guidelines not only assist social workers and potential social workers in animal welfare in getting an understanding of what their position may look like, but they're also showing relevant parties such as employers what that role can entail and how a social worker may fit within their practice.
Nice. Thank you, Kayla. Yes. That takes us right into my next question, which is from the full title of the guidelines. Many folks would look at them and think that they are just for social workers who are working in animal welfare or who are wanting to. Can one of you talk about how these can be useful for animal welfare organizations and staff and how they can engage with the guidelines to strengthen human and animal well-being?
I can take that one. Yeah, so first of all, full disclosure, we think every animal shelter and every animal welfare organization should hire social workers, plural. Yeah, right, Kelly. I mean, but so that's what we're going to put that out there, that is where this is going with all of this. However, that's future state. Current state, we know that it's just not happening right at this moment. So the beauty of these guidelines is that I think that they really, and speaking as someone who was a social worker working in an animal shelter for years and never had that job description, never had any sort of recognition as a veterinary social worker, just a animal welfare professional that had an MSW and kind of I like to talk to people, right? I think this goes such a long way in validating our profession and shining a light on this and what it can do for animal welfare organizations that don't have a social worker or even no plans currently, but will in the future. It really shines a light on a blind spot for us, right? So we have our pets and the animal welfare community, but it's a triad relationship, right? It's that other end of the leash or the cat carrier, or, we think about those 3 points of a triangle: the pet, the animal welfare organization, and the family. And so these guidelines lay forth not just, duties of what a veterinary social worker can do for you and your organization, but they put out a philosophy and they put out a mindset of what social work means, and how we can look at the entire family system that Augusta was talking about, because in order to create good outcomes for pets, we need to include their people. And so when I say mindsets, I mean, I'm thinking about, what Kayla spoke about, our NASW Code of Ethics. We think about dignity and worth of person. Clients' right to self-determination, meaning we trust that people are the experts of their own life experiences, and we empower them to make their own decisions for their family and for their pets, and we support them, right? A strengths-based perspective, assuming positive intent, assuming that people want what's best for them and their family. The importance of human relationships and building trust with a community, trauma-informed communication, family-centered care, cultural humility. All of these ideas are woven into the guidelines, and this allows animal welfare organizations, just by reading this, to take a different perspective on any element of your work that you're doing, because where people are thriving, animals are thriving, and where people are suffering, animals are suffering. And this can increase your outcomes, but it also increases the resiliency of your team, because when you actually give power back to the pet parent, that is, you are helping your team let go of control over outcomes, right? And so that increases the resiliency of your team members as well. I will stop there.
Oh, that was wonderful, Laurie. Thank you so much. And got comment in the chat as well. Really taking some complex things and boiling them down for us. So these guidelines that have been put together were just released in 2025. However, many of the strategies that are in there emerged from what folks are doing, social workers and their animal welfare colleagues in animal welfare settings across the country currently, and when the guidelines were being developed. Could one of you share implementation challenge around a strategy program, one of those in the guidelines, and how it was overcome?
Yeah, sure. I'd love to talk about that. Coming from an organization where I was the first social worker hired, I think we had to figure out a lot of things and a lot of moving parts. And what would this look like? What does a social worker embedded in the community look like? What does it look like embedded with staff and staff support? And how do we do that in a way that honors our code of ethics and who we are as social workers, but also make sure that we don't put our organization at risk for liability or things like that. And so one implementation challenge that I think that we had to overcome, and I would imagine many other social workers in animal welfare settings have to overcome too, is confidentiality, right? What does that look like? How do we support people, but also make sure that we don't put others or our organization at risk? Specifically when we are working with staff, right? Which is a different sort of dynamic that doesn't really happen in other, in a lot of other social work settings, right? A lot of our people, a lot of our clients are members of the community. And so in animal welfare, though, we know that staff experience a lot of the stressors that members of the community do, right? Like this work is not easy work. Our staff are susceptible to stress and mental illness and a wide range of other issues that come along with doing this work. And so we had to think about how do we set that boundary that honors us as social workers, but also make sure that the organization is okay with it and make sure that we are still caring for our colleagues, our staff members who look to us for support and for resources and a safe space to share those emotions with, right? And so something that we looked to was kind of figuring out, let's have that conversation with our HR department. Let's figure out how do we do this? And one question that we had to answer was, when does someone, a staff member, come to social work? And when should they go to HR? And we kind of negotiated where our boundaries were, what I was comfortable with, what our organization was comfortable with. We spoke with leadership, right? What are some of the things that they're hearing that staff need? What are some of the spaces that they feel like, hey, you know what, someone could have really benefited from talking to someone that wasn't me as a supervisor, but could talk to the social work team or a social worker in private and in confidence. We set those parameters, and then it kind of became its own thing, right? We know as a social work team at APA, we know when we should kind of say, hey, let's take a step back for a second. What you're sharing with me is important, and I might not be the person that can help you with that, but HR is probably the better department to talk to. And and walking them through what that looks like, right? And helping them feel safe to then take the next steps to talk to HR. Or when does HR then pull us in, right? What does conflict resolution look like? When do they say, hey, you know what? Before we kind of take this in a step that might seem excessive to some folks, why don't you talk to social work about it? And why don't you figure out maybe what some next steps are that you can take so that you can address a problem directly before it becomes a bigger problem and needs to come to us. So that was something that we were very particular about and very clear on. And so our disclaimer before working with our staff is like, hey, everything that you share with us is confidential. We want to be able to support staff. But if you share with us that you are thinking about hurting yourself, hurting someone else, or hurting an animal, Or if we're not the right person that can help you solve this problem, that is when we might bring someone else into the conversation. And it's not about breaking confidentiality out of, anger or fear. It's really about wanting to still support the person where they are at and making sure that they get the resources that they need.
Thank you so much, Alexis. With social workers and animal welfare and veterinary settings, we can be community facing, public facing, and that's straightforward and looks like most of social work. We could also be peer facing, where our colleagues, as you so beautifully explained, are also our clients, and that is tricky. Yet to be able to offer confidentiality appropriately and connect a person with the right supports in and outside of the organization is what makes social work as effective as it can be in animal welfare settings. And I think that's a really important strategy that you highlighted there for us. Thank you. So we've talked about benefits, benefits for staff, benefits for community in terms of how the guidelines support social workers themselves. But let's get down to the how do we pay for it? Because there's always some need to cover the cost with a new position or project. So how would you recommend one make the case for and cover the cost of adding a social worker in an animal welfare setting?
I'd like to talk about that. I, like Alexis and so many other veterinary social workers, I was the first veterinary social worker at the Oregon Humane Society. And like many others, we were sort of building that plane as we flew it. We weren't really sure what it was supposed to look like. And we weren't sure, I saw someone's question pop up, we weren't sure where in the org chart I was supposed to fall. Who was I supposed to report to? What were my daily duties supposed to include? And to Alexis's credit, like, what was the confidentiality supposed to look like? What were these pitfalls? Kayla talked about what an exciting time. And it was exciting, right? To be like, what could this be? It's also a little bit exhausting, right? To think, what could this be? And also, what is the scope of my practice? It's something a social worker is always thinking about. So I think that the one thing I encourage people to think about is you're probably already doing a lot of this work because animal sheltering and animal welfare is already moving in this direction. A lot of us in animal sheltering, and I've been doing it for more than 20 years, we're already thinking about keeping pets and people together. We're already having a ton of community programs that are offering things out into the community to try to get folks access to services and programs where we want people and pets to stay together. So the idea of having a social worker, or how do I get the folks in my area to buy into having a social worker with us, is that you're already probably doing some of this work. And isn't this a great idea to have a trained professional with you who can help do this in a way which is reducing harm, which is trauma informed, someone who is a trained expert, who is helping in the community, who is already going to help lay the foundation and the groundwork. So I think in the way that we're asking you to present it to the board or to your people and culture or human resources, this is the way to do it, is that you're probably already doing the work and being able to formalize it with a role that is trained in a profession that adds so much value to it. So I think that's a great way to think about it. I also think that for figuring out where the money is going to come from, because especially in a nonprofit world, that's really a big question, right? We always think about things like PetSmart Charities, Maddie's Fund, where's this money coming from? And grants are a huge way that it gets paid for, right? I think when we were talking about like Seattle Humane, and that's a grant funded role, right? That was a grant funded role for them for, I think, 2 years. And those do come with parameters. But when we're talking about social work and social services, it also opens the door to think about money from funds or interest and donor dollars from people who weren't your typical animal sheltering or animal welfare donors. And I think that's really exciting to think about. So when you are looking for money to pay for this role, you are opening up a whole new flood of donors and a whole new flood of donor dollars from folks who aren't just thinking about pets in your community, but they're also thinking about the people attached to the pet. And we often aren't tapped into that for donor dollars. So think about the people who are interested in donating for domestic violence, for veterans, for other pots of money in your community, and pets happen to always be a part of that as well. And I think for me, just so you know, I actually report to our chief medical officer because I'm attached to our community vet hospital. But before that was open, I was under operations and I was part of our admissions department, because for surrender and keeping pets and people together, that is where we're connected. But here at the community vet hospital, I also wear the hat of grief and bereavement and pet loss and keep those things up to date. So there's a lot of different ways that social workers interact in the animal sheltering or vet med world. And so we can we're a little bit of jack of all trades, so we fit in a lot of different places. So, and the International Association of Veterinary Social Workers, we're so lucky to have Augusta on this call. We have a wonderful board. I saw Dylan's name pop up here. We have a wonderful board, and they are so progressive. They have our job descriptions, no matter where we might fall, and they are so willing to share those and get you connected to someone who might be able to tell you about what it is we do, where we fall in our org chart, and how we are funded. And we are so willing to share that information. We never get tired of talking about the work.
That is the truth. Thank you, Kelly, and thanks to each of you. Those were the questions that I had prepared for our panelists, so we now have some time to open it up to folks who are watching. And
we have some questions, Janet. They are coming in, and
yes,
Augusta's trying to answer as we go. But I'd like to. I'll read some of the questions off and let you all decide who's going to answer them. So I love the idea of having a VSW assist in HLE work. How do we make the case to the powers to be how beneficial this role can be to the team as well as the people they come into contact with?
I assist on our humane law enforcement cases, and they are able to utilize my services. I just went out on a case yesterday for a time when we're not able, or we think it's appropriate to charge someone, and or we think someone might need mental health support, which, spoiler alert, they probably all need mental health support. So being able to go out to help that person in the moment, as well as get them resources. So making a crisis plan for someone, making an attempt to get them help. We follow up at 30, 60, 90 days. As well as I have a 6-month and a 1-year mark. And we think, although we are still working on data, that it does help folks not become reoccurring problems later on, as well as supporting the team for setting it up as we do SMART goals with folks. We are looking at the ending as we start, which is something a social worker would do, and maybe not something humane law enforcement would do, thinking about it. Although I will say, I think animal control officers and humane law enforcement are doing a much better job these days of looking at things in a less punitive way. So I think that there's a real good case for doing social work services with humane law enforcement and animal control hand in hand. And I could talk about that for an hour, just basically what we do all the time, working hand in hand, not just with staff, but with the actual client.
Well, that kind of goes into another question of, have there been any agencies that have combined human government funded social services in a nonprofit role? I know there was a domestic violence coordinator in Oklahoma that was half paid by city, half paid by animal shelter. Has a similar model been done anywhere else? I'll open that to anybody. Janet, you have an answer or thoughts?
Like to take that.
It's my dream. Does anybody want to hire me somewhere? Because if you could have access to everybody's social services in the building, if you could just refer them to the services.
I think that wasn't there one of the folks in our group was I think she was in New Mexico. Wasn't she?
Pacheco.
Yeah. So there is an example of it out there. I don't know much about it. But there's at least one, N of one that we know of.
Yes, thank you, Kelly. I was when you said that, her name came back to me, and she I believe had some municipal funding and was literally split. She's I believe a licensed mental health clinician, and so provided mental health services in some capacity to folks, and also addressed the human animal issues that emerged as we've been talking about, and that are more, related to the guidelines. And that is the only model that I am currently aware of where it's so kind of bifurcated. Like literally, she has a completely human focus on one side, and then animal welfare setting, social work genre on the other. Anyone else think of? All right.
Well, I have a question that I think is really, I love that Eric is asking this. How do we best support VSWs, given that you're the ones who are carrying such a heavy load and so many people will be looking to you for mental and emotional support? So outside of the obvious built-in boundaries for the initial programming, I love that.
I would love to answer that, because I think what I have benefited from the most, and what I hear other VSWs struggle with, is that they're the only one. They need a team. We need teams. We need to be able to share that burden. We carry a lot of that grief, a lot of just a lot of the heaviness that comes with the work, and that could be easily identified. And I think we kind of we have our jobs, and then we get thrown into other stuff, because why not, right? Like social work, that sounds like a social work problem, right? And so my biggest, I think the biggest thing I can offer is that social workers need teams. I think there need to be at least 2 social workers at an organization to share and to be able to bounce off the support that we need and ideas and things like that. In other organizations where social workers are bigger teams, right? What makes the work sustainable is that we're able to support each other and kind of get ideas from each other and brainstorm and figure out how to best support clients and people and all the things that are going on. When it's just us doing that by ourselves, that can be really tough and really hard to make the work sustainable for us.
And so along with that, what is the recommendation for staffing hours for VSW? Should it be weekends and evenings in addition to standard operating hours?
Here's the deal. A social worker could work 24/7. I mean, that's part of what, I mean, and I work at an agency where we do work 24/7, right? So, and so it never ends. So just allow your social worker to try different hours, allow them to try different things. And along with Alexis said, that's part of the self-care. That's part of the sustainability of this as well. Let them set their boundaries, let them figure out where the focus is. We actually are trained to do needs assessments, and that's part of what a social worker does. So allow your social worker to come in to the organization, do a needs assessment, and sit with you and partner with them on what actually are priorities and how to spend their time. Because honestly, a social worker works anywhere where there's people, and that's just overwhelming on the face of it. So with hours and scope, really make sure that the scope is clear and it's agreed upon by you and the social worker.
I'll also
Go ahead.
because this is a hot topic, because I think it's also very important that when you bring a social worker in, that you need to trust their education and their evidence-based practices, and also allow them to train the staff in those skills. That's what social workers do. We want to be able to give you the skills that we know, because we're one person. So while I would love to work weekends and nights and holidays, because that's where crises come, absolutely not. So allow me to teach your folks and how to do my work. We want to be out of the job someday. That's the goal.
So we're coming close to time, and there's a lot more questions coming in. So we're going to make sure we put these all over to the Maddie's Pet Forum so you all can answer those there as well and keep the conversation going. But I'm going to combine a couple of them into one, which was, so how do they get started in veterinary social work? Where do they go? And I know that the University of Tennessee is a good one, but could you give some idea? How do people get started in this? I'm going to call on.
Well, I'll do my, no.
Okay.
So the International Association of Veterinary Social Work came out because we saw this emerging need and we knew that we needed to connect. All of these guys are my colleagues and coworkers, and so that is our professional organization. We have a summit every other year where we're going to do an hour-long panel discussion on this topic there. Like this, that's where you can go connect. UGK has a wonderful program, postgraduate and concurrent. There's also some other really good trainings that are coming up, but definitely encourage you to connect with us.
Well, and I hope all the panelists look in the chat because there's a lot of love for you over there saying what wonder workers you are. So I hope you all got to take that in today. And yeah, we will definitely be continuing this conversation over at Maddie's Pet Forum. So please join us there. And Janet, do you want to give just a quick shout out because you'll be doing again next month on kind of a similar topic. If you just want to give a quick thing on what you'll be speaking on before we sign off.
Yes. Next month, December 16th, it's Tuesday, same time, noon Pacific to 12:30. It's called Positive Support. So pardon the cheesy title, but it's about peer support and how to support each other without overly burdening you. So talking about things like support versus trauma dumping, some basic practices to help us work with our own bodies so that we're calmer and more centered. And essentially, what was talked about here, getting some of those skills and tools into your hands so that you can better care for both yourself and your community of colleagues, all of who are working so hard. Thank you so much for all you do.
Thank you so much for joining us. I think this means we need to do this again because we had so many good questions and so many people. So we're going to have to tap you all again to come back and talk with us again. So I know Kelly can talk hours, so I think that should work. So thank you all for joining and have a good day.